Pages 3.4. I mentioned that the liver also synthesizes cholesterol, and it also uses the cholesterol. So what's cholesterol used for? Well, cholesterol essentially is used for two things. It's used for cell membranes, and it's used for producing things. In cell membranes, the cholesterol is used for permeability and fluidity. Remember, it disrupts the phospholipid membrane, allowing fluidity. And it's also used for producing things, producing bile acids, which then become bile salts. It's used to synthesize steroid hormones, and it's also converted to vitamin D by sunlight. Too much cholesterol, however, causes gallstones, which leads to jaundice. If you have excess cholesterol synthesis in the liver for whatever reason, then you'll get too much cholesterol in the bile, and if this passes above 80%, then you'll get these gallstones forming, which are like crystal balls of cholesterol in the gallstones. And what happens in the bile acid, and what happens is this obstructs the bile duct. When you obstruct the bile duct, you get colicky pain. Colicky means it comes and goes, and it's very severe colicky pain. And you also get a backup of bile back into the liver, into the bile canaliculi and the hepatocytes. And this will cause jaundice, which is hyperbilirubinemia. Bilirubin is the breakdown product of red blood cells. Hyper means too much, emia is blood, so too much bilirubin in the blood. That's jaundice, because the hepatocytes will rupture and the backup of bile will enter the blood. So let's have a look at these. Let's have a look at these ducts. Liver, gallbladder, and ducts. So the liver has, as I mentioned, it's got the two lobes, right and left lobe. The right lobe and the left lobe. It's got the hepatic ducts coming off the liver. And these hepatic ducts then join to form the common hepatic duct here, shown here. The gallbladder, however, this has the cystic duct. And the cystic duct and the common hepatic duct join to form the common bile duct, which is, when it's joined by the ventral duct of the pancreas, then it forms a swelling. A swelling is an ampulla. So it's the duodenal ampulla, or the ampulla of Vata, which has around it the sphincter of Oddi, which sphincter is a circular muscle. Sphincter of Oddi controls the release of bile and pancreatic secretions into the duodenum. So now that we've looked at what happens to glucose in the glucose function of the liver, and also the lipid function of the liver, and the synthesis of cholesterol, now let's look at some of the proteins and hormones it produces. Well, what proteins and hormones does it produce? Well, in terms of proteins, it produces transferrin, which is related to iron movement in the blood, hepcidin, which is a regulator of iron absorption, VLDL, which is very low density lipoprotein, fibrinogen, which is a protein in the blood, clotting factors, which allow clotting, and albumin, which is a binding protein in the blood, and also fibronectin, which is for coagulation. It also synthesizes hormones, IGF-1 and angiotensin. Angiotensin, which is involved in the RAAS system, renin, angiotensin, aldosterone system. And what angiotensin does is it causes increased blood pressure and retention of sodium and chloride and secretion of bicarbonates. The liver also does, as I mentioned, has a detoxification function, which is it's three things. It's drug elimination, which is getting rid of the drugs. It's biotransformation, which is converting the drugs into a less toxic form. And it's ammonia elimination, which is getting rid of ammonia. So first of all, let's look at drug elimination. Well, drug elimination, drugs are either soluble or insoluble. and this will affect how they're eliminated. Soluble drugs, they're detoxified, and then they return to the sinusoidal blood, and they're excreted in urine because they're soluble, so they're excreted in urine. However, if the drugs are insoluble, then they're effluxed and excreted with bile acids and salt. So the soluble drugs enter the sinusoid, the insoluble drugs enter the bile canaliculi and are excreted with bile acid and salt. So that's the drug elimination function of the detox function, right? Next is biotransformation. Well, to transform a drug into a less toxic form, you need to do biotransformation. And this is what happens. Well, first you have phase 1. And in phase 1, oxidation and reduction happens by cytochrome P450. And this increases the water solubility and detoxifies the drug. However, this also produces a toxic intermediates of paracetamol and estrogen. So drugs and hormones, when they're biotransformed, in phase 1 reactions, the intermediates produced by P450, cytochrome P450, they can be toxic. And after phase 1 reaction of biotransformation, you then have phase 2 reaction. So what's phase 2 reaction? Well, this is conjugation by glutathione transferases, which is not that important, but it's conjugation essentially. The important part is squared P450, oxidation reduction in phase 1, and conjugation in phase 2. And what this does is it increases the water solubility further and detoxifies the drug even further. Overall, phase 1 and phase 2 reactions reduce the toxicity of the drug. Now, I mentioned estrogen. I mentioned estrogen. Just as a quick side note, estrogen, if it accumulates in males, it results in large breasts, which is called gynecomastia, and also a loss of secondary sexual characteristics.